I first want to start by thanking you all for joining us for our WPS GHA webinar this morning. It is 10 a.m. Central Time on April 5th, and we are going to be reviewing certification and recertification statements for Medicare documentation requirement for therapy services. My name is Rachel Wood. I am one of the nurse analysts with the WPS Provider Outreach and Education team. On the line with me today, I'm joined by my coworker, Mary Sue. She is my fellow nurse that works in provider outreach alongside myself, and some of our other coworkers are on the line as well. Mary Sue is going to be monitoring our chat this morning, so any questions that you do have as I go through our slides today, please enter those into the chat feature and send those to all panelists when you put that into our chat. So, as I mentioned, if anyone has been on our line for a bit, this information should also be in our chat as well, but materials for today were provided to you through the WebEx reminder email. So that does include the slides as well as a timely topic handout. There's no other additional handout for the information today. The slides, again, were sent in that reminder email. And to access these, you may need the course access number and password, which are also, again, in that email. Don't worry if you lost it or you can't find it. If that is the case, please email us at wps.gha.education.com, and we can work on getting that slide deck to you. Right, and so I do just want to mention too with that is that it is not an attachment at the top of the email. It is a link that says download course materials within those reminder emails. It is kind of easy to miss. So again, it is in the body of the reminder emails for this webinar. That is how you access our slides for today. All right, so I will get into our slides as we do have a good amount to get through in our hour today. So really quick here, this is our disclaimer. Basically what this disclaimer says is that our education is for informational purposes only. Medicare does change their rules and regulations from time to time, and they do send out official Medicare communications often, and that is going to take precedent over anything that I talk about today. So please take a look at those CMS communications when they come out for up-to-date rules and regulations, as that, again, does take precedent over what I present today. Additionally, another thing our disclaimer says basically is that no recording or photographing of hopefully we get a good quality, and you can view it later. You know, if you have any other questions or just want to, show a coworker or what have you. Okay, so let's talk about objectives for today's webinar. So our objectives for today is for providers to reduce errors for outpatient therapy certification as well as recertification statements. That is a pretty straightforward goal, but I will say that a lot of the times our nurses review these claims, they do see things that I'd like to call them repeat offender type mistakes. So there may be things that I talk about today that you feel you hear all the time from us, but that is because they do continue to pop up in the documentation that we review. So please bear with me if you feel like you've heard us talking about certain items when I get into that issue and error section. All right, so on to our agenda as well as the outline for our webinar. So I'm going to start by reviewing the documentation, best practices and what we're looking for with outpatient therapy certification and recertification. We're going to start by talking about overall documentation requirements for therapy services, and then more specifically, certification and recertification statements. Then we're going to talk about some common errors with some example scenarios for those errors. As far as resources go, I am going to be referring to guidelines that are found in the Internet-only Manual 100-02, Chapter 15, Section 220, Certification and Recertification of Need of Treatment. need for treatment, I should say, and therapy plans of care. Additionally, we do have some great documentation resources on our website. So that is WPSGHA.com. If you go to the medical review section under the guides and resources tab, that has some good information, and where I'll be pulled some of our information today through some of our slides to talk about documentation and what we're looking for there. We also have some newly posted YouTube videos that break down each Medicare element, a little bit more in depth. So we do currently have one up there for certification and recertification statements, and we'll be down the road releasing stuff that talks about evaluations, progress notes, and so on. So watch our e-news for updates about those future videos. And then if time allows at the end, we will also, I'll pull up some of these resources and just show you, where they are, where you can find them, and what I'm talking about. All right, so I quickly want to start by talking about Medicare outpatient therapy documentation requirements and how our medical review team interacts with this information. So our WPS medical review, or otherwise sometimes referred to as MR, is mainly made up of nurses that review claims sent in to us for Medicare beneficiaries. Some of their goals of medical review is to prevent improper payments and ultimately protect the Medicare trust fund. They do that through education to providers on Medicare rules and regulations for the services that we are reviewing. So a big area that our MR nurses do review is outpatient therapy documentation, and that includes information from physical therapists, occupational therapists, as well as speech-language pathologists. I will be focusing with my examples mostly on PTs and OTs today, but therapist does refer to all three of those professions. All right, so let's start with an overview of some of the documentation elements that our nurses review for, and I guess I'd call it complete therapy documentation. So this information is also included on our website, and again, I am going to be focusing on certification and recertification statements a little bit more into this presentation, but I do quickly want to review all of the elements of therapy documentation. Again, Medicare documentation requirements can be found in our IOM and on our website. So this is all the pieces that our nurses would look for when they receive a therapy claim sent into us, and we're looking at the corresponding documentation. This list is not in order per se of how you would do on our slide here. So to start, past medical history as applied. So, that would include what's the reason for this person coming into therapy, and what are some of the past medical interventions and things that they've had done prior to today's visit. Next is plan of care. So that would include treatment goals, both the long and the short-term goals with corresponding objective measurements. And with those goals, we are looking for, where we started, so what's that baseline, and then where are we going? So that's why those objective measurements are very important. It does allow us to see, is this person progressing, and how are we measuring that progression? Or are they not, and it's evident because they're not reaching the goals that were established. Additionally, in our plan of care, we are looking for type, amount, and duration of the services that are provided. Treatment records, so this is this a new patient? Have you been treating this person for a while, or have they been receiving therapy, but maybe they've been going to a different therapist and now they're new to your practice, but how long has that therapy been going on? Progress reports, so this is an update of how the beneficiary is responding to that plan of care. It should be completed per Medicare guidelines every 10th treatment day. This is something I'll talk a little bit more about as we get through our slides, but progress notes versus recertifications is something that providers from time to time will confuse, and our nurses have been seeing this in their reviews. But again, I'll talk a little bit more about, the differences in our slides throughout this presentation. So next up here, we have evaluations or reevaluations, and this is where the documentation answers the why. So why is a beneficiary seeking care from a therapist? Why are the skilled interventions that therapists provide required for this person? In an evaluation, the clinical examination and the therapy eval, so that is establishing baseline and what the future, what are we measuring, is going to be done in that evaluation. An example of maybe something what a physical therapist might evaluate would be general movement, balance, range of motion, strength, and any other specific tests that is going to support why you're providing therapy services for this patient and establish a baseline to then establish those goals and write that plan of care. And then finally, we have our certification and recertification statement. So this is what the rest of our slides are going to focus on today. For the IOM, certification is the physician or non-physician practitioner approval of the plan of care as written by the therapist. Certifications do require a date with a signature, as well as that signing certifying provider's credentials. In the next few slides, I'm going to talk a little bit more about an initial certification versus a recertification, what our reviewers are looking for, and then what are some of those common errors that providers are making, and what are we seeing when we do these reviews with our medical review department. All right, so we'll start with the initial certification statement. So again, this is completed either by a physician or non-physician practitioner, and this is done within 30 days from the start of care for that beneficiary. And these are just some things from the IOM that I want to highlight. So for services to meet the Medicare documentation requirements, to meet the coverage criteria, services for therapy are or were needed because the individual needs that therapy. There is a plan for furnishing services that has been established by a physician, non-physician practitioner, or by the therapist providing such services, and is periodically reviewed by a physician or non-physician practitioner. And then finally, services are or were furnished while the individual is or was under the care of a physician. And so in certifying an outpatient plan of care for therapy, a physician or non-physician practitioner is certifying that all the above criteria that I just listed have been met. So that is directly from the IOM, and it does give, reason of why we're talking about these statements and why they're so important. So basically, certification is a requirement for coverage as well as payment of a therapy claim. One thing I want to highlight with certifications is that the cert statement is not always the same as the provider order for therapy. Sending in an order is not a Medicare requirement. It is something that providers do from time to time. It is an error that we'll talk about a little bit later in our slides, but it could serve as certification if it meets all of those requirements. So it has the credentials for that certifying provider, the date, and supports that they've reviewed that plan of care, but it's not, an order alone does not meet the certification requirements. So on our slide here, we have listed a few, quote, acceptable documentation of certification. So an example would be MD progress note, and this would include a statement such as the provider has read and agrees with the therapy plan of care as written, and again, signature, date, credentials. Something vague like a statement such as patient receiving therapy from that certifying provider without showing any additional details that they have taken a look and do agree with the plan of care as written does not particularly meet that initial certification, those certification statement requirements. So basically what we're looking for with that initial certification is documentation showing the certifying provider has reviewed that plan of care and agrees with the next steps for what the beneficiary, is going to receive and is in support of that treatment. Certification statements are valid for either 90 calendar days following the initial start of therapy, or the length of the plan of care if it is less than that 90 calendar day window. After the 90 days end, providers should seek a recertification statement if they do plan to continue with additional therapy. And then one thing I do want to point out is that per Medicare guidelines, chiropractors are not eligible to provide certification or recertification statements. Providers that would be, that is listed in the Medicare Learning Network article, which I believe was also included in the course materials as well. But examples of that include MDs, physician assistants, clinical nurse specialists, or nurse practitioners. All right, and so that does bring us into recertification statements. So as I said, this will occur every 90 calendar days after the initial start of therapy or at the end of the outlined plan of care if that is less than 90 days. One thing with recertification statements, it does not have to be recertified by the provider by the provider that originally certified the initial certification. So it can be done by a different provider, and that is something that I think may cause confusion. You don't have to track down that same person, because I know providers may switch or maybe aren't the same one that's, you know, on service that month or so on. Additionally, another time a recertification would be needed is in the event of a reevaluation. So if there's any significant changes happening to that patient's plans of care, significant changes to what, you know, you modified the plan of care, what then was originally certified, a reevaluation would warrant a new certification and that recertification process. All right. So we've set the stage now and have gone through what the requirements in general are for therapy documentation and what initial certification statements as well as recertification statements are, what we are looking for on those reviews. So I want to talk now a little bit more about some common errors that our nurses see when reviewing these notes sent into WPS. And with those few errors, I also have a couple example scenarios we'll go through. All right, so error one is missing signatures. And this is something that seems to come up a lot in a lot of the presentations that we do when we talk about documentation. Missing signatures always seems to be somehow in the mix. And I think that really highlights how common of a error this is, how easy these things are to miss, and how, you know, often signatures might be excluded from the notes. So I do want to stress that this is a Medicare requirement for the certification statements to be signed and dated with that signing provider's credentials to bill for therapy services. Notes that are sent in that are not signed would be denied, and we want you all to be paid for the work you're doing. You did all that documentation, you did, you know, everything right, and maybe the final item and missing piece is that missing signature. So, you know, it's very, very easy to miss, but also a very, I would say, frustrating reason to receive a denial and then have to backtrack and figure out what happened and so on. So please make sure to get that signature with, again, the date and the provider's credentials on those certification statements. All right, so our next error is missing rationale for delayed certification. So as I mentioned, or it was on our initial certification slide, certification statements are accepted within 30 days following the start of initial therapy without, you don't need a rationale for delay. They're considered timely within that 30-day window. Between 30 and 60 days, we will accept them without a rationale, but if you have one, that would be good, but it's not something that we're particularly going to track down and ask for. But then when we get to past that 60-day mark, that 60-day time frame, then we're going to want to know, you know, what happened and what caused that delay for receiving the certification for this plan. We do know that providers are very busy. There will be sometimes not immediately provider available to review and certify the therapy plans. That is where that 30-day time frame comes in. So, we understand there will be some administrative time, some time to get the certification and the information from A to B, so therapist signing certifying provider, back to therapist, into us. But again, the 30-day window, you don't need any rationale. 30 to 60 days, don't particularly, it's not something we'll probably ask you for, but then after that 60-day mark, it would be something we would be looking for as to, what happened and why it was not, why was it not certified sooner. So just a quick statement of, what happened and what the holdup was would be something we'd look for in the documentation. All right, so on to our third common error, and I guess I could also kind of call it a provider confusion a little bit. So this one is, should we complete a recertification statement or should we do a progress note? So our nurses have been seeing this quite often in the notes that they're reviewing. So providers are completing that 10th day progress note and then billing it as a recertification and maybe even seeking a certifying provider's signature in that process. So, if you are seeking that additional signature, that is causing more work than needed if it actually is a progress note. So progress notes are something that is needed per Medicare every 10th treatment day. And basically, they're giving an update on that patient progress or lack of progress towards the outlined goals in their plan of care. Recertifications are only needed to be completed either every 90 days, when that plan of care ends, if it's less than 90 days, or if there is a significant change to what was originally certified in the plan of care. So in our next couple slides, we did create a couple examples that I want to talk about. Each one is either going to be a recertification or a progress note situation. As I review them, feel free to put in our chat, what you think, if it's a recert or if it's a progress note, and I'll take a peek as I talk and see, if we're all on the same page or not. All right, so progress. So our first example, here we have Mrs. Smith, and Mrs. Smith is receiving physical therapy to treat right knee pain. So she's being seen on her 10th treatment day, and we can assume here that she's within that 90-day certification period. We don't have dates included in this one, but we're going to assume that she's still within that window. The PT notes show the following information. So no change to her condition. She's continuing to progress toward her goals in a positive way, and nothing is being changed than was originally certified in her plan of care. So in this instance, this is something that should be a progress note, not a recertification. Nothing is significantly changing in what her plan of care has, and the therapist is really just providing that status update. So again, this is something that does not meet the recertification needs, but would just be something you send in for a progress note. All right, so moving to example 2. So now we have some dates on this example. The notes were written for today, April 5th, and we're treating Mrs. Jones for right hip pain. She was initially certified for her plan of care, and that was initially completed January 6th of 2023. And in the therapy notes, there's no changes to the patient condition. She is progressing toward her treatment goals. They do plan to continue that current plan of care and do want to continue with therapy. So what type of situation is this? Progress note or recertification? So because we are 90 days past when the plan was initially certified, this would be something that a recertification would be required. So no changes other than we've hit that 90-day Medicare limit for when they want plans recertified if continuing therapy. All right, and our final example. So we also have notes for, today we're pretend it's Mrs. Jones's husband, Mr. Jones, and he is receiving therapy for left knee and hip pain. So they've come in together for their appointment today, April 5th, and his plan, he started therapy a little bit later on March 5th, so he's still within that 90-day certification period. Upon assessment, the therapist documents that Mr. Jones recently slipped while shoveling some snow during one of the lovely spring snowstorms. For those that are in the Midwest, it's very, very valid thing to have happened, and is having increased left knee pain since that fall. So due to that, the therapist has now made some modifications to what was originally certified in his plan of care. So based off that information, is this a progress note or a recertification statement? So because there have been changes and some significant modifications to what was initially certified, this is also something that should be going through that recertification process. So yes, we are in the 90-day period, but there have been significant changes made to his plan of care. So again, something because of those changes that would need to be recertified. All right, so the final item that I want to talk about is missing documentation elements. So here we have a couple different things on our slide that our nurse reviewers are seeing either missing or, have heard questions from providers that they've talked to regarding cert statements. So the first one is submission of provider orders with certification only. So this is something I've talked about at the start of this presentation as far as submission of an order for therapy. It could be something that meets certification criteria. So if this provider includes their credentials and a signature in addition to like their name and their credentials, as well as the date, and some type of statement that they've reviewed the plan of care as written and agree with it. But an order in general does not typically meet that criteria and is also not something that Medicare requires providers to do. They can do it, but it's not a documentation requirement. So submission of the orders only would not meet those certification statement requirements. Next up, we've seen in notes that there is intent or there's a plan to have the provider certify the therapy. However, there's no certification that was actually completed or was sent to us with the notes that were sent on to support that claim. So in this situation, we can only assume that, there was some type of communication breakdown between maybe the facility and the providers, and somehow there was a gap in the loop for providers to actually evaluate and actually get that complete certification done. So, a suggestion would be look at your process, evaluate how your facility goes about facilitating that, interdisciplinary communication between therapists and certifying providers, and what are the things that need to be done to make sure that, we know the intent is there, but it actually never followed through and there was no certification actually done. So what are the gaps in your process to make sure to prevent that if that's something that, occurs for your facility? And then finally, we've had providers say that they're just not aware that certification was a requirement and they just didn't know they had to do it. So this is something that providers do need to be aware of as far as Medicare documentation requirements if they're providing treatment to Medicare beneficiaries. So, if that's something that maybe you felt or this is new information to you, please take a look at our resources on WPS as well as Medicare's information on in that IOM and so on, just to make sure you're not missing any information, because unfortunately, just not knowing it's not a valid reason to circumvent a denial of a claim if that certification is missing. All right, and I just see here, kind of on the corner of my eye, what length of time can we write the recertification? It would be needed every 90 calendar days. So if you are in So that would be the length. It can be shorter if that's, you're not going to probably treat them for 90 calendar days, but 90 would be what Medicare signifies as their when they would want the plan then recertified again. All right, so final thing, we're in the home stretch. I just want to touch on some documentation best practices and maybe tips for certification statements. So on our slide, we have a few items that we hope providers do keep in mind regarding certification statements. So before submitting notes and claims into for Medicare beneficiaries to us, ask and review, is the certification something that includes the following? So provider signature with credentials, date of certification clearly written, and identifying so some key points of our slides that we've gone through. So we started in our presentation by talking about Medicare's outpatient therapy documentation requirements in general, what would be considered complete documentation, where to find some of those resources, and then more specifically what we're looking for with certification and recertification statements, when a progress note is appropriate and when it actually should be a recertification statement. And then we went through some of those common errors, so missing signatures, missing elements within the documentation, orders only without the additional elements that are needed for a complete certification, were some of the errors that we talked about today. All right. And before I pause for questions, I do just want to briefly mention our timely topic handout. This is basically just an extra fact sheet that we included just for some, topics that we talk about a lot at WPS. So this information can also be found on our website, but some of the things that are in that timely topics include some of our innovation challenge topics, which are depression screening and chronic care management, some information regarding that. And then one section that I want to highlight, and it might not apply to therapists per se, but if maybe somebody is on the call here that does billing for the inpatient setting, or maybe does apply to them, I just want to mention CMS has recently seen an issue that hospitals are refusing to treat beneficiaries with open Medicare as secondary payer records. So again, probably does not apply to many people on this call, but if it does, I want to highlight that that information is there and take a look at that if it's something that applies more specifically to you. All right, so with that, I do want to pause and take a look at our chat and see if we have any questions. And then I think Mary Sue, it looks like there's some about the certification timelines. If you don't mind, I would love it if you could give a little bit more expansion on some of those questions.
Hi, Rachel. Oops, I'm sorry. Can you hear me okay?
Yep.
Okay, sorry. I was getting a little finger happy with the mute button here. There were several questions that had came in about, if a physician doesn't respond, sent multiple attempts, and several people had kind of asked a similar question. So I thought I would just get on here and respond to everyone. So this happens. We recognize this happened, and you're attempting to get your physician signature agreement with the plan of care, whether that's the initial certification or whether it's a recertification, and you've made multiple attempts and you're not being able to get through. A couple things need to happen here. First of all, document every attempt and document every means in every way in which you tried to make that attempt, every means in which you made that attempt, whether it is via electronic, whether it is mail, whether it is fax, whatever, in whatever way you made that attempt. I don't care if you send a carrier pigeon, document the way in which you tried to make that attempt to get that certification or recertification. So that's going to be one thing that's going to help protect you in the interim. If you're getting, for the initial certification, if you're getting close to that 30 days and you have not received a response from that provider, a few things need to be considered on your behalf as the provider. First of all, is there another physician you can go to? Does the patient have multiple physicians that they are seeing? Chances are with a lot of our Medicare beneficiaries, they do have multiple physicians, and one of them would be willing to certify the need for the therapy services if you give them, you know, the medically necessary justified means. Some physicians will want to see the patient before. Maybe the patient has not made a visit with the physician prior. And some physicians will just want to actually see that patient before they say, okay, I will go ahead and certify the patient. So it may be a matter of getting that patient back to the physician for them to agree to sign it. So unfortunately, that patient may need to, you know, go back and make a visit. Sometimes it's a matter of having the patient contact the physician's office. Maybe the patient has had a visit. Maybe it was agreed that if things do not get better, you start physical therapy. The patient presented to you, they started their therapy services, but now we're not getting the physician to sign. In that case, maybe it's going to necessitate the beneficiary also trying to contact the physician office to say, hey, what's the issue? A lot of times the beneficiaries, once they start squawking, the providers will be like, oh, yes, I did get that request and I haven't sent it. And oh, yes, looking back, we did agree that therapy would be the next means. If you cannot get any kind of certification, it may be time for you to consider discharging that patient from services, because you're not going to be able to continue services without physician involvement. That's part of the requirements of therapy for Medicare to cover, is that you have to have physician involvement. And we see that physician involvement via the signed plan of care. So if there's not physician involvement, you're getting at close to that 30 days, you may need to consider, you know, telling the patient that services are not going to be paid by Medicare, perhaps issuing an ABN if you have the need to issue an ABN, letting the patient know that you would happily continue services, but they may be at the patient's financial cost. I would hate to see that happen. And like I said, in the interim, make every attempt possible to get that certification or recertification, and document every means that you've made to obtain that information. So I hope that kind of helps those questions that were similar. As I'm going through and looking for additional questions that have come in for Rachel, let's see. Certification was for 90 days, but the plan of care within the certification, the frequency was PT twice a week for 7 weeks. When would the certification be due? we can wait for the 90 days, or would it be due at the 7-week mark? So in this case, and Rachel, I'll just go ahead and answer this one for you since I'm talking and not asking the question. So in this one, someone asked, 90 days or the duration of the plan of care was written for twice a week for 7 weeks. When would it be due? Whichever is sooner. If the 90 days ends up to be quicker than the amount of the duration of the plan of care, you would have to recertify at the end of the duration or at the end of the 90 days. If the twice a week for 7 weeks ends up to be sooner than 90 days, then that's when you would have to get the recertification. And I say that because sometimes we have beneficiaries that something happens and they may miss a week, or they may miss a couple of weeks because of maybe illness or because of travel or, what have you, something, a snowstorm or a tornado. There are things that may happen and that may push out the time frame. So whichever one ends up to be first, 90 days or the duration of the plan of care, that's when the certification would end. Let's see. And then, Rachel, I'm trying to look through questions, and I'm sure you were doing the same as well. Okay.
Yes. Go ahead.
There's one question here on what documentation is required if the therapy cap has been exceeded. Are there certain things that must be documented that help support medical necessity? And so when we talk about the old therapy caps, or now the KX modifier thresholds is what they're referred to now, those monetary amounts of outpatient therapy. When your patient is nearing and exceeding that monetary threshold amount, that first threshold in which you would append the KX modifier, there really shouldn't be anything different to document, because your documentation should always be supporting that services are medically reasonable and necessary. So when we look at your documentation, the things that we are going to look for are services medically reasonable and necessary for this duration of care that is currently being provided. So we're getting into a situation where we're going to exceed that monetary threshold. So the documentation, again, would always need to be written to the fact that services being provided need to be medically reasonable and necessary. And those are the types of things that we're going to look for. So Rachel, I'll let you take the next question, or any questions that I've missed as I'm scrolling through quickly.
Sure. So it looks like the next one, and also with any of these, please feel free to weigh in and add on to any of my answers. But the next one is, what is the best practice in recertifying a plan of care when an additional body part is added during the course of their original plan of care? What if it is a different physician ordering the new body part? So this is best practice would be, this does require recertification. You're changing what was initially certified in that plan of care. So that would, fall under that initial significant change and would need to be recertified. As far as best practices go, I think it would just follow kind of the things we outlined. So getting their signature, credentials, sending in the information and what's going on. As far as what if it's a different physician ordering the new body part, the recertifying provider can be different than the one that initially did the certification. So if that provider is included in that beneficiary's treatment, then they could be the one that does the recertification. You just want to make sure you have all the information as far as, what's going on with the person's treatment plan, what are the updates, and then on the certification end, that there's an acknowledgement that they've reviewed the changes and agree with any additions, and have their credentials, date, and that really, I think, you should be good doing it that way.
And then just to kind of add on to that, Rachel, so remember, if there's a significant change in the patient that warrants a new reevaluation, you can do a new reevaluation for this patient. Like if there's a new body part, if something significant happened that warrants you to look at two different body parts, do your reevaluation, which is billable, and you would at that time have to do a recertification. But if you can't get one physician to agree to certify both a new plan of care that includes both body parts, because if one was referred by one physician and one was referred by another physician, you can run two different plans of care in the outpatient service. Know that in the billing world, in the billing system, it doesn't know that those are two different plans of care. So you also then have to remember, if you are one physical or occupational or speech language pathologist and you are providing services to a beneficiary, and on Monday, Wednesday, Friday, you are doing your arm, and on Tuesday, Thursday, you are seeing them for the leg. The system doesn't know when certain things have to happen, your 10-day progress reports, things like that. I mean, well, that one is not necessarily true, but like that evaluation, reevaluation dates, it doesn't know that you are running two different plans of care. So you have to kind of think of things as the systems, you're smart, the system's not. The system thinks it's just one person going to one therapist, so it doesn't know there's two separate plans of care. So if there's time frames for things, you have to keep those in mind in the billing world. Rachel, do we have until only 10:45 with this one, or till 11?
No, we have until 11, so we have a couple more minutes to kind of get through these. Yeah.
Perfect. Because I see there was a question that came in that says we typically, and I'm kind of jumping around, so you'll have to go back to. We typically do progress note every 10th visit or 30 days. Is that correct? Then reinsert the end of plan of care in 90 days. That is not correct. Your progress notes need to be written every 10th treatment visit, regardless. So on or before every 10th treatment visit is when your progress notes are due. And then recertifications are due at the end of the duration of the plan of care, or 90 days, whichever is less, or if there's a significant change in that patient's functional status. So they kind of don't have anything to do with each other. Progress notes have to be done on or before every 10th treatment visit. And your final progress note is your discharge note. So that needs to also be done as well.
All right, thank you. So our next one that we have that I want to answer is the plan of care a separate document, or can it be included in the initial evaluation? So it doesn't have to be a separate document. We're just looking for all of that information to be included in the medical record for the patient. So I've taken a look at some notes, and therapists do it differently, but oftentimes the initial evaluation will be, at the top, and then it'll go through what tests they've run, what's the baseline, what are the goals, and then that plan of care is kind of at the bottom with, what we're going to be doing for this person, what's the assessment, what are the timelines, what are their exercises for physical therapy, as an example. So, typically it's all kind of included together. So it can, as long as we have all the information, it doesn't have to, I guess, necessarily be together, but that would be something we'd be asking you for if they are separate. But no, it is not necessarily a separate document.
One question I want to, or one thing I want to address, Rachel, is that I did see, I think it was Kathleen, I'm kind of trying to scroll through things, but someone had said they can't figure out how to get the slides in the handout. So I did just put the email address in the chat again, all by itself, and email that email address, and we can get those sent over to you. I want to kind of take a second to address this as well. So as we moved away from our Learning Center and into just using WebEx as our primary registration means for our live events, for our webinar live events, you know, one of the things that we are doing is we attach our handouts and stuff in our webinar information. And that attachment should go out to you guys in the email that says, you know, download handouts or download and view. And some people get in the email, some people see the link that says download and preview webinar materials, and others are not, and we're not sure why. And some of you I have already reached out to personally and said, hey, can you please send me your email that you received so we can look into what it looks like on your end. So I want to thank those people that I have reached out to that are sending, you know, that have sent me those emails. Some are getting some things that look kind of weird. We apologize. We're working really hard on our end, guys, to make this as easy as we can for you guys. But if you didn't receive that link in one of your emails, it would have either came in, what should have came in, your registration for this webinar has been approved. So it would say download and preview webinar materials. And then in the reminder emails, there should have also been that. And if it didn't, again, we apologize. Go ahead and email that email address that I included in the chat, which is wps.gha.education@wpsic.com, and we'll go ahead and send everything over to you. You didn't miss anything by not having the slide deck in front of you, because Rachel showed you everything that was in the slide deck. So again, thank you, and we're working really hard to make sure you get everything you need, and we're going to continue then with the questions.
And I am just scrolling through, looks like Keith just put in, and I think this might be our last question just for time, just put in one that says, you may have addressed this, and I apologize if so. Does the patient always need to be under a referral, or does the plan of care the therapist formulates and gets signed supersede? In other words, in an original order for therapy states 4 weeks, but the therapist writes the plan of care for 8 weeks, and the physician signs. Do we also have to get an additional order from the physician since the original didn't cover the whole time frame? So I just want to address the order piece. That is not an order for therapy, is not a Medicare requirement. It's something that a lot of providers sometimes do, but it's not something that we're, you know, you're required by Medicare to have. So if and Mary Sue, please weigh in on this too, but my understanding of that is that if the order comes in, I think the plan of care and the certification of that plan, that window of how long that plan is certified for would supersede an order that states maybe less than what is certified. Again, because the physician's signature on that certification statement is, you know, showing that they have reviewed and agreed with what it outlines that the therapist wrote. So if that is longer than that order sent in and they have signed that plan of care, my understanding is that it would be something that would take precedence, because again, an order is not something that is required for therapy documentation by Medicare. All right.
Yeah, you're correct, Rachel. And the other part of that is that a lot of times you'll get an order from a physician and they'll give you a preliminary plan based on what they think may be reasonable and necessary for the patient, but they're generally not the experts. You guys that perform the services are the experts. So when you actually evaluate the patient and formulate your overall plan and send it back to them, if they agree with it and your time frame is different than what they said, but they have signed your plan of care, then your new duration of care is whatever they agreed to. So if they initially said for 4 weeks and you send it back to them and say, hey, this is going to take me 6 weeks, and they sign it agreeing with you, then your duration of your plan of care is 6 weeks at that time.
So, and I want to thank you guys all for your questions. We got a lot of really good ones. If we did not answer your question live or in the chat, we will, get that answer out to you in some way. I want to just pause because we are in our last couple minutes and talk a little bit about our survey and any, course completion needs, which really isn't anything but the survey. And, so you pull the survey up, you can just open your camera, hover over that, and then it should take you to a link. Tell us what you liked, what you didn't like, what you wanted to hear more about from us, maybe a little bit less for future webinars. We do read through these surveys after every presentation, and we really, really value the feedback that providers give us. So, like these Post-it notes, we want, to know if you're feeling sad or kind of or happy, which we hope everybody, leaves us today with that smile, happy face. And again, so you can use that QR code for the survey. And when I do close the webinar today, if you would rather take it using the computer, you can do that, and a link should pop up, a page should pop up. It kind of looks like spam, so that's why I wanted to mention it. It's not, it's our survey link that, WebEx generates that. So you can also do it through your computer, and I believe there should be a link as well. You get a thank you for attending email once we close out this webinar today. As far as that thank you for attending email, that is also something that if you do, let me just switch over here, course completion. So if you do are looking for continuing education credits, and this is what you can use for your certificate of achievement. So it is that closing email that says thank you for attending, and that would again you'd be using for CEUs if that's something that you're looking for. So with that, I want to again thank you all for attending. Just a couple things we have coming up. Tomorrow, as a follow-up event, we are going to be hosting in the afternoon on April 6th, April 6th at 1 p.m. Central Time. It's for 30 minutes, so pretty quick for those that are busy in the afternoon. But I am going to be pulling in that. Please sign up on our website, on our training page under the live events section. And we hope, to see you all there. And that, I believe, will conclude our webinar today. So thank you all for attending, and we hope to see you at future events. Any questions that you have maybe following today, you can either come to our presentation tomorrow or email us at wps.gha.education@wpsic.com. And have a great rest of your day. This concludes our webinar.